Another idea I've had, and this is a complex idea that takes somebody other than myself to explore, is that Medicare is going to run out of its funds, its reserves, in 2026. That's 6 years from now. And Social Security is going to run out of its reserves in 2035. So that's 15 years from now. Medicare provides medical coverage. Social Security provides income and retirement. Why not have health savings account that could do both? You could merge DPC and health savings account with Medicare and Social Security and do it in one package. Somebody else needs to explore that whole thing. But how would you measure the success of healthcare? Well, it'd be easy. You could measure the percentage of people that have DPC, like 660 DPC providers right now, but hopefully we could cover the entire country, and the number of people with the HSAs. We already know that. It's increasing by about 1.5 million per year. It has been since it was introduced in 2003. So it's growing every year. It's replacing flexible spending accounts, as it should, because you lose the money if you don't spend it in flexible savings account, which is the incentive to spend it, whereas in health savings account, it accumulates over time and it becomes retirement income after 65 when you can withdraw it without penalty. And the second thing is looking at the overall cost of health care. Right now, as I mentioned, 2018 it's 18%, 11,172 per person. I'm sure it's higher than that now, 2 years later. I brought up a note of $650 when I started practice in medical in Perham, started an office there. I charged $650. $6.50. I said that to somebody on the plane and they said, well, I wouldn't spend $650 on medical care. No, it's $6.50. And we only had one charge for an office call. Now we have 5. We slice and dice it, and computers allow us to jack up the price to a higher level. But back then I could make a good income. I had my nurse and I had somebody at the front desk, that's all. I wasn't supporting 16 people because I had to document everything or else I didn't do it. I just charted by exception. The things that were wrong I wrote down. Now you write down everything so you can charge more, but because the law requires it. It's a crazy system. To summarize, I'm an advocate of number 2, obviously. Patient-directed healthcare, DPC with HSAs, engage people in their own healthcare and providers in providing it, and reduce the health and financial inequities. And my aspiration is to create a populist movement to achieve this. Anyway, thank you, Detroit Lakes Dune Rotary Club, for talking on this. My name, by the way, is Bob Koshnick. Everybody in the room knows me, I'm sure. I practiced here for 44 years. But anyway, thank you.